if it's this commotio cordis, again, if it's that 1 in a million sudden impact, there's not anything you can do to reduce the risk for that. That is a very tragic, 10, 20, maybe 30 cases a year. And it's just wrong millisecond of time, right? And so for many of the other things, the more common things that are associated with sudden death, things like hypertrophic cardiomyopathy, then screening is a huge one. So that's the leading cause of sudden death in young athletes is hypertrophic cardiomyopathy when you talk about cardiac causes. And people think the incidence of that could be as high as 1 in 500. That means for all of you on the screen, you had someone in your high school, most likely, if you had more than 500 students that had hypertrophic cardiomyopathy, or at least had that mutation, that gene abnormality. So again, I think it comes down to, history and physical exam and sometimes ancillary tests like EKGs or echocardiograms. But for the most part, it really is history and physical exam and trying to find those at risk. When you have in North Carolina, there's a detailed sports, questionnaire that's asked, and one of those is about sudden death and was there any sudden death or unexplained, events. And I think when those are checked positive, we need to do more work. The onus is on us as healthcare providers to screen these families and try to figure out, is this something that's preventable? Every time something like this happens, the first thing through all of our minds is, was this preventable? Is there something that we should have picked up or could have picked up? Was there something in Damar's history or anything going on? And if not, then maybe it was this really freak thing. But I think that's what all of us as healthcare providers worry about, is we don't want to miss that.